Welcome to Mental Health in Focus, brought to you by Flow Vector Systems. We're passionate technologists dedicated to helping businesses get started and thrive with AI integrated solutions. Find flow state in your business. Now let's move on with the podcast.
All right. So let's go ahead and jump right in. If you could just give us a brief introduction to yourself, your practice, your story is fairly unique to some of the other folks I'm talking to, and so maybe talk about your timeline and working in mental health, and we could just get going from there.
Sounds good. So I'm Heath Holt Hayes. I own a business consulting company, specifically specializing in mental health, addiction, and recovery policy programs, you name it, anything in that space. And I come to it by virtue of serving the state of Oklahoma for 14, 15 years in a variety of different capacities. But how I got interested in the field specifically was because of my own struggles and challenges associated with mental health and addiction that really stem back from early childhood all the way up until college, when I really hit my lowest point. And I decided to join in on the recovery movement personally, and then found a passion to help change systems and improve processes and improve programs and increase access, essentially, at the end of the day, to mental health addiction treatment services. So I'm personally motivated in this field, and have made it a lifelong commitment to see through changes and making it a better situation for other people.
That's fantastic, and I just really appreciate that about you. My mental health journey is, of course, lifelong, but really didn't come into focus until about 10 months ago. As we had talked about a little bit before, my story, kind of coming into this with an alcohol addiction, and really discovering sort of my mental health journey from there, like looking back at the all the way back to the beginning of my life, and understanding sort of how I got to that point, and really working through this mental health system, and finding some opportunities to improve, and really wanting to sort of give back and lean into that a little bit. So while my journey is much shorter than yours, I think we align on some of the same goals. So appreciate that. Yeah. So I was wondering if you could talk just a little bit about, people who are just, sort of getting started on their mental health journey. What's the best way for them to just sort of lean in? I know that one of the challenges I faced was not knowing exactly who to reach out to, and calling a psychiatrist, because I thought that was the right thing to do. And that's a 6-8 week period to see a doctor, and I need help right now. So super frustrating there. And then to talk to a counselor didn't seem like the right thing. I'd seen counselors in the past, and that didn't seem like the thing that's going to help you through whatever my mental health struggle was at the moment. So for people who are just like, I'm frustrated, I don't know what to do, I know I need help, what's the best way for them to get started?
I'm glad you asked that question. I want to even just kind of preface and lay even more of a foundational element to this too, because I feel like everybody, no matter who you are, has to take care of their mental health.
Yeah.
So many of us forget that's a core part of being human, and because of that, we neglect our overall well-being and our mental health specifically, and then it can become a severe mental illness or addiction issue later on if we're not taking care of it. Just like I said earlier, where do you pinpoint it? Where did things start to go sideways? Well, I think it's at birth, where we all already are traumatized when we're born, just by the process of being born, and then really don't pay attention to it or support it along the way. And so I think it's important to just acknowledge that everybody has mental health, whether or not you experience challenges with it. Just really depends on your ability to thrive, and your resilience, and your environmental factors that come into play, because anybody is one stressful event away from having a mental breakdown, which could lead to all kinds of different coping mechanisms like drugs, alcohol, all of those things that beget addiction, gambling. And so For me, I think that that's the beauty of what we were working on in Oklahoma, and what the entire nation is working on, is to make a low barrier, easy access to anybody who needs mental health treatment or support. And those are just 3 digits. It's 988, and 988 will connect you to the appropriate individual that will provide the support and the resources and kind of the next steps on where you should go and how you can be supported. And oftentimes, just reaching out to somebody to talk through your anxieties or fears or some of the challenges that you might be experiencing, and having somebody to talk to and feel confident and secure in that relationship is all that you need. But if it's not enough, that's kind of the purpose of what 988 is designed to do. Just like 911, you call when you're in an emergency type of situation. Well, 988 is there for emergency situations too, but it's also there just to help somebody kind of think through, I'm not sleeping enough. I can't, find rest. What is, I need medication. I need to see a psychiatrist. Well, a 988 person on the other line can talk through, some of those symptoms that you're having and the challenges you're experiencing, and give you guidance and direction on what the next step will be. Oftentimes, like I said, just, having that person to talk to on the other end is just enough. But for a lot of people too, finding out like what is the first step, and where is my local treatment center, and who takes my insurance, or I don't have any insurance. How do I get treatment support? And 988 will be able to, it's a culmination of all the resources that are localized in that state. And every state is charged with kind of operationalizing what that looks like. And so it's different in every state on what you get on the other end after you talk to somebody. But what we have been designing in Oklahoma, and what other states are replicating as well, is having different touch points. So you call 988, and then they can help you connect to a local treatment facility, whether it be outpatient or a crisis center, which is a little bit more intense, or intensive outpatient services, which is, you're still on an outpatient basis, but you're getting support and treatment more intensely for a longer period of time. Or if in the event that you actually do need some hospitalization, 988 can help facilitate where the local hospital is, and in some states get you there, be able to transport you there, and get you to that safe, secure location so that you can get some respite and be able to stabilize, and then find out what ongoing treatment looks like, or ongoing support, whether that be through a psychologist or a psychiatrist or a counselor, or my favorite thing, which is a peer recovery support specialist, somebody who's actually lived that recovery journey, is living well in their recovery, and is able to help support and guide you through what those next steps will be, and be a beacon of hope for you, if you would, to say, oh, I've done this, you will be okay, you can do this too, and I'm here to support you along the way.
Yeah, I'm so glad you mentioned that. I would say that in my journey going through inpatient to IOP, or PHP to IOP, those people that I was able to connect with, that had been through the process, had been through it, speak in real terms, like they're not afraid to cuss and tell you all their nasty stories, and talk about how they were able to overcome. And same thing in AA as well, hearing some of those stories of courage, hope, and ultimate recovery has been super helpful, right? It's great to have a counselor to talk to, someone who's very professional, but at the same time, it's really great to relate to some other people that are just normal people. Yeah, so great. I'm so glad you mentioned all that. You mentioned a 988. I think you were pretty instrumental in implementing 988, particularly in Oklahoma. Is that right?
Yeah. That the whole nation a few years ago was charged with gearing up and getting ready, as the FCC allowed the 988 digits to be activated, just similar to 911. And so every state, in terms of their kind of packaging it together, how they were going to communicate it, and what that service delivery system looked like on the back end, was up to the states to be able to decide what that looked like. But in Oklahoma and a lot of other states, we really wanted to make sure it was comprehensive, and so that there was something for everybody, every touch point, and every point in which you might be experiencing challenges in your life. And so, yeah, it's grown leaps and bounds, and we all continue to learn from one another to the best ways to communicate what 988 is, and the best ways to differentiate between 911, 988, and 211, because those are all three different three-digit numbers that provide resources and support for people who might be experiencing a loss of housing, or a loss of income, or a loss of job security. And so being able to kind of not to kind of know the difference between those three numbers, and the operability between the three. So hopefully at one point we'll get to a situation where you, as long as you remember three digits, either 911, 988, or 211, they'll be able to kind of cross communicate and be able to connect you to the appropriate person that will be able to support you through whatever challenge you're experiencing.
All right, so you can educate me on 211. So I'm a Gen X guy, and I know what's the 411, but what's 211?
The 211 is more of a crisis of social need. So if you're experiencing like food insecurity or housing instability or loss of employment, 211 can help you meet those basic needs and identify different resources within a community, because there's different nonprofit and different faith-based organizations within every state that have different resources to pay your electric bill, or pay your deposit on your first month's rent, or identify job readiness programs that might be able to help support you. So 211 is one of those resources to which might beget a mental health crisis or an addiction crisis, or might have led to an emergency situation where there's a physical need that needs to be stabilized. And so it's kind of a tiered approach and a tiered system where all those numbers exist to be able to help support a person, whatever they might be experiencing.
That's fantastic. I didn't really realize that there was this sort of ecosystem of help available over the phone. If you think about those three resources, do you feel like all those three resources are very aware of each other and reference each other as they're working through issues?
Yeah, they are now more than ever.
Okay.
Not at the very beginning. I mean, 918. So the way it's kind of worked is 911 was first, and then 211 existed, and then now 988 comes because we see so much of a prevalence of people experiencing mental health challenges and addiction challenges, and so it needed its own dedicated support system and call center to be able to help people navigate that situation. But for so long, 211 was kind of the de facto 988, where inundated with calls. And so once we started the 988 launch, 211 was very excited because they now felt more equipped and prepared to have a workforce and a system that was integrated and could be able to better support people who are experiencing specifically a mental health challenge.
Yeah, that's great. It's fantastic. I'm learning as I'm going through these conversations. I wish I would have known all this when I was in need, right?
I know, me too. I wish it was existed when I was in need.
Yeah. But it's great now. We can go tell everyone we know, and try and spread the word as best we can. And hopefully some others will have an easier path than we did.
Exactly. I always have to, come back to this point of 911 didn't happen overnight. And so, we're still relatively new in the infancy stages of 988. So we should be satisfied of the progress that we've been able to make so far. But one of the last things that I helped before I left state service was, the transition and the transfer process between 911 and 988, because so many of those calls will, cross over, or there might be a co-response that might need to be provided from law enforcement support and a mental health professional. And so, trying to figure out how that works. And in Oklahoma, and I'm sure it's very similar in other states, we had 200 plus 911 operating centers in Oklahoma. And so in the protocols and the processes and the procedures established for what it looks like when you call from this county versus another county is an undertaking in and of itself, and the way that kind of structured it. And so I assume that is very similar experience in other states. Yeah. Interesting. Well, let's kind of shift focus just a little bit. I want to
maybe more broadly about the industry of mental health care. And what are you seeing, sort of from a thematic perspective, things that are working and maybe some things that aren't working, where things could be improved a little bit?
Yeah, workforce is definitely the biggest challenge that the mental health industry is experiencing right now, for a lot of different reasons. I think mostly because there hasn't been a lot of people interested in going into the field or not really knowing where they fit. I know when I started down this path, I thought I had a specific path and a specific trajectory on what it is that I could do to contribute to improving the mental health system. And I thought that that was to become a therapist, or a physician, but that's not the case. There's so many different ways in which people can participate and become part of the system. So workforce is a huge issue, especially in getting people who are licensed mental health professionals, so like the therapist level folks, to go through the schooling and the education. Another reason why people don't necessarily, or haven't in the past, wanted to go through all of the educational requirements and the supervision requirements that are associated with becoming a licensed therapist is because it doesn't pay a lot of money. So you would go through all this work, get a master's degree and 5,000 hours of supervision, and then you're still in a poverty level before you can even make your own basic needs or meet your own Maslow's hierarchy of needs, if you will.
Yeah.
So workforce has been such a huge undertaking in order to help support and bolster the system up. And so that's another reason why I really feel like and can see a pathway forward for people who are in recovery, who are living well in recovery, and specific roles that they can play within the system. And so I advocate, and what I do a lot in my own consulting business is try to help support the growth and the development of the peer recovery support specialist, because it is you have a lot people who have a lot of education and have attained professional development that way, but your lived experience is also valuable.
Absolutely.
Able to use that in a way that is and meaningful and intentional, so that you can best support people, because we see it work all the time. And so really professionalizing the role, creating a career ladder for them, for us, if you will, to have a specific space in the system, has really been my focus, and I really feel like will help solve the workforce problem, which is what one of the major themes that we're having right now in the system itself.
That's fantastic. In my brief experience so far in the system in Los Angeles, there's a huge recovery community in Los Angeles, and just to see that most of the people that are working in the recovery centers, the inpatient, the IOP, the PHP centers, they're all folks that have been through treatment, right? They have lived this experience, and then they have found their way into either becoming a counselor or a representative that works with insurance companies. They find their niche and sort of work their way up through that. And you got the techs that are working on site at some of the inpatient places, and then just like independent contractors who go through some training and learn about a particular subject, anger management, or sort of anything along the mental health care journey, and just go and do a couple hours a week at individual recovery centers and talk to folks and help bring people along. So it's great to see folks that were maybe on the street and on their last leg in some sort of addiction or mental health care challenge, and then find themselves in recovery and then launch a career in recovery. It's a very cool journey to see, and it really changes your perspective of the people that you see on the side of the street.
Absolutely. It's a beautiful thing. I feel very lucky and fortunate to have been to spend most of my life in this career field. And what other career field can you not only be able to help support people, but you're also helping and supporting yourself along the way, because the accountability there, you have somebody who might be looking up to you now, who is looking at you as a role model for what recovery will look like. And that is just an awesome feeling to be able to be part of that. whole system and circle of
Yeah.
life. Yeah.
Yeah, fantastic. Yeah, I could see it just brings such a huge smile to your face
Yeah.
to even talk about it. So yeah, the passion is there for sure. Yeah, so let's talk about some of the logistical challenges. So there is, telehealth versus in person. There's legislation and insurance, and sort of all of the business and process that is surrounding mental health care. What do you see are some of the challenges there?
Yeah. I would say one of the things that happened as a result of COVID is that a lot more people now recognize that they have have experienced some mental health challenge, whether it have been uncertainty of what the future holds, anxiety related to uh, just the life and impact of what COVID, how it changed to society, um, or just the isolation and the separateness that we have because of technology, and because of the social isolation that has resulted as a COVID. And so I would say, before COVID, we were pushing really heavily in Oklahoma the use of telemedicine, the use of telehealth.
Hmm.
Um, so many people were resistant to it because we have this idea of what it looks like to get mental health treatment, and that's to lay down on a couch in front of a doctor and
Yeah,
spill your life story, and that's what's supposed to happen, and that's how you get fixed, if you will. But that's not the case, and so because of COVID, we didn't have any options to provide services, and a lot of things started to move to a virtual format, such as employment, working from home, interacting with your physician, your court system, whatever the case may be, using a virtual means. And so I would say that as COVID happened and as we were trying to push this initiative, the adoption rate of being able to use and successfully use telemedicine changed substantially, not only for Oklahoma, but for the whole United States, as we transitioned and couldn't provide services as report without any other means. And so that was really helpful, and being able to get more people comfortable with the use of technology to be able to provide those services. And so at the end of the day, what that's doing is creating more access. And luckily, for most part, all of the rules that kind of prevented, that virtual means as a way to provide services and delivery of services were amended so that we could continue to do that post-COVID. And so
yeah,
some policy changes as a result of that, and the establishment and the sticking, making those more sustainable and sticking through those changes has been able to be supported. And again, all it does is help. What it does at the end of the day is help increase access and be able to provide those services virtually. And so people are more comfortable with being able to see your therapist in your car and your lunch break on your phone,
yeah.
if the case may be.
Hmm.
Provide support via text messages, so you can get words of affirmation from your peer recovery support specialist, or to be able to check in, or have an accountability lever to whatever it is that you might be going through. And so I would say that, along with the reimbursement rates, so that you can be as an organizational perspective, be able to be reimbursed and compensated for delivering services in that modality, has been something that we see as post-COVID be more easy to change, and easy to sustain, and easy to change the rules and keep them permanent in that sense.
Yeah,
And now the door is wide open to how else can we integrate technology? How else can we provide these services, mobile services, and virtually? And so, in Oklahoma and other states, as part of that 988 continuum, we have a mobile crisis response unit. And so that is another way in which services are provided. So if you are an individual experiencing a crisis, but it's not at the level where you need to go to a physical location, but you might need somebody to come out in a face-to-face environment, you can have a mobile team come out and provide that ongoing care and support. And whether it's just one person who also has an iPad that has connection to a therapist, so a peer might,
hmm,
the person who comes out face-to-face, be able to give you some visual support, or some physical support there, but also have the professional there with them, but they might not physically be there, is another
yeah,
way using technology and leveraging the limited workforce where there's, there's a finite amount of therapists to be able to be across the state at one point, but there's a lot more paraprofessional people who could be the boots on the ground and help kind of facilitate that. So an integration, a hybrid approach, if you will, technology and real life human support.
I love that. That's fantastic. Is that something that 988 is all skilled up on, and they kind of can make a determination about, hey, maybe this is the type of service someone might need?
Yeah, and it's all kind of dependent on the state and their readiness level and their implementation phase of where they're at. But yes, the mobile crisis teams are a core piece of the comprehensive continuum of care that is 988.
Nice. Yeah. That's fantastic. All right. Gosh, I'm learning so much from you today, Heath. This is awesome. I want to stay on the telehealth side of things as well, because I think that there are some challenges with that as well. With insurance coverage covering telehealth at the same sort of rates that they're covering in-person care, you're going to see, well, we have seen a number of folks close their practice doors, right? And so they're not seeing people in person anymore, and they're only seeing people online. So I think that there's some check and balance that's happening as the industry is moving here a little bit. Can you just talk maybe a little bit about your thoughts of in-person care versus the online care, and maybe some of the challenges we might see as we're going through this shift?
Yeah, I think one of the biggest ones is, and you've seen this, I think, I'm trying to think of the last state that I saw that they passed some legislation with regard to kind of ghost providers, if you will. I think that's that they've used, where you might have an HMO say that we provide mental health care, but when you would go on their website to look for the provider, that provider doesn't exist. They might have, 20 years ago, but that's not the case anymore. And so there's been a huge movement to kind of verify and recheck and have accurate representation of those providers that you are saying that, yes, we offer full person care as an insurance provider, but that might not be the case because, we haven't updated our registry or our lists in, 20 years. And so in states pass legislation that kind of shores up what that really looks like and kind of differentiate. Are you an in-person provider? Are you a virtual provider? Do you do both? And so that the person who is seeking care and has a means by which they can, utilize their insurance to gain access to that care is not being led down a path where there's going to be left empty-handed at the end of the day. And so that's one big piece as we see as in terms of challenges associated with, there's an equity there. There's an equity issue there for mental health care as it relates to physical health care. And there's been, some strides and movements to making sure that everybody gets access and everybody's covered. If you have insurance, you're not, going over here and having a separate insurance for, your head and your mental health versus your physical health. Those are all things that are connected and interrelated. And so we need to, make sure. And so the next phase was, okay, if you offer care, make sure that you're being truthful and accurate. And when you're trying to connect people to those specific specialties as it relates to mental health care. But I would say some of the high points is that because we have virtual access and because it is an accepted and reimbursable method by which you can receive treatment and care, people show up. They are actually accessing the services because it's more convenient. There's not as many barriers, and because more providers are being reimbursed for virtual care, that might be the way that they provide the care. And so in terms of the difference in virtual care versus in-person care, I mean, we're really seeing more people show up virtually than we do people show up physically because, all kinds of things can happen. I know from my own lived experience having children. I have 3 children, and one of them is seeing a counselor right now. And, getting all the kids to school at the right time and then making appointments and all of those things, there's been many times where I've just appreciated the fact that I can have my daughter sit in this chair and receive her treatment and care while I'm making sure the other kids are getting to school on time or getting to their activity, so that she can have that service and provide it in the comfort of her own home. And she prefers it. And so I think that that's another thing to be to comment on, is that a lot of people prefer the intimacy of, you know, a place that they might not have, you know, otherwise thought that could be a treatment setting.
Yeah. No, I think that the benefits by far outweigh, you know, that maybe some of the challenges that are associated with this. I think one of the maybe micro stigmas, if that's a real word, that may come along with this is, you know, as I was going through a treatment center, you know, they were saying your next step, you know, after you get out of here is, you know, making sure you're connected with a counselor. In person would be best, right? And then there's no one available, right? Everybody's booked out 6 months, and yeah. So, and then you sort of feel like, okay, well, then I guess I kind of have to go to this virtual thing, and maybe it's not as valuable, right? And I think that micro stigma is something that could be a challenge, and we should work to, you know, sort of promote more of the benefits rather than, you know, sort of pushing people down a second choice. You know, I think if we could put everything at the same level, like if you could see someone in person, great, if that's something that's good for you, but in person is just as valuable, just as helpful, and kind of put them at the same level so they don't feel like they're getting, you know, secondhand care, because they're going online.
Exactly. And, you know, I was just talking to my dad earlier, and you see this in a lot of different kind of sectors or different parts of society. You know, your generational comfortability with technology, right? So it was telling me that he needed to transfer money from his savings to his checking account, that he needed to go down to the bank to do that. And I was like, why would you have to go physically down to the bank to do that? Are you like taking the money out and then giving it back to them? Like, I don't understand. Like, why can't you just do that online? He's like, well, I guess I could. And I'm like, yeah, Dad. Yeah. So I think about that in the same way. It's like we just might be comfortable and have a stigma associated with using technology to do X, Y, and Z. But what really do is, like, we have these tools at our fingertips, and it's to make our life more convenient, just as effective as, you know, going down to the bank in person.
Yeah, absolutely. What a great analogy. Yeah, the only reason you go to the bank now is you have to open a new account.
You're right.
Some weird thing that you have to do, or present your passport or something, you know. It's more of a hassle than anything else to go to the bank nowadays.
Think about those brands, Hims and Her, where you can do any type of, you know, consultation with a, you know, qualified physician, and get it billed through your insurance. It could be whatever the case may be. Do that at the comfort of your own home, or in the comfort of your car, or wherever you're at, having a mobile device to be able to do that. And I think that as that becomes more, you know, normalized, I think that, you know, mental health care, physical health care, whatever the case may be, will be the, you know, kind of seen as the same, because I'm getting just as an effective, you know, assessment or intervention virtually as I would in person.
Yeah. Earlier on, Teladoc, you know, over COVID, I was using Teladoc. And my family was using Teladoc, and you know, we found that it worked, right? You know, we were able to be diagnosed and get some medicine, and never go in and have to see another doctor. But
and it get delivered to your door, you know, like that. You don't go to the pharmacy, like it's just mailed to you. Like, that's amazing.
Yeah. Well, now Amazon's going to be dropping it off with drones on your front porch.
Yeah.
It's pretty cool. Oh man, well, very good. Well, a couple other questions for you. I want to maybe just shift focus a little bit to your own business and your own practice and what you're trying to do. So Triple H, what's exactly the name of your business? Triple H.
Triple H Consulting. So my Heath Holt Hayes, and I picked something. So that was the hardest part of starting my own business, was what am I going to call it? I feel like that's, you know, it needs to be evergreen. It needs to, you know, make sense. And so, yeah, Triple H Consulting is just my initials.
Fantastic. I love makes me think of WWE. Yeah. So that's awesome. So maybe just talk a little bit about maybe some of the things that you're working on over the next 6 to 12 months, and yeah, what some of your goals are.
Yeah, so for me, staying in state service, I mean, that was always been my life, and providing community-based care. And the last part of my career, as I sat as in the seat of the deputy commissioner for the Department of Mental Health and Substance Abuse Services, I spent a lot of time um, really trying to help other states, other leaders kind of think through what it is that they wanted to do, or learn from some of the mistakes or successes that we've had in Oklahoma, so that they could make, strides and different improvements within their state. And so like I said, I spent a lot of time in my official capacity doing that. And, just at a point, I was like, I might as well just bite the bullet and start my own thing. And because I'm enjoying this part. I always knew consulting was in my future. I didn't know that that was going to be something that I would do sooner than later.
Mm-hmm.
So, being able to help other states or help other municipalities or university systems get out training and development around different workforce issues, that is kind of where my niche is, and being able to again share my lived experience as a result of being being an operator of hospitals, or being a leadership member of a state system, just to provide some guidance on, well, this is how we passed this policy in Oklahoma, or this is, the perspective that we took from how to fund, or how to, fundraise for the building of this new hospital. And have you ever thought about different philanthropies and foundations, and what's the responsibility of a local municipality to provide support and services for, a city, versus is it always going to be do we always look to the state, or do we always look to the federal government to be able to solve all problems, or do we take some of the resources that we have and we know it's a need as a community to be able to better support that? So I spend a lot of time in my consulting role. I'm just helping people think through that, and kind of gear up to what it is that they're doing, and be able to challenge some of those just based on my own experience doing it. And so it's great to be able to sit in the seat and be able to provide that support and to provide that guidance. But one of the other great things about being a consultant, I get to pick what I do.
Mm-hmm.
So I get to do the things that I love.
Yeah.
And things that I love are the things that I've been talking about so far, which is primarily the workforce of peer recovery support specialists. So getting those established, growing them within states, thinking through how you could best utilize people in recovery, which junction points, which inflection points across the continuum make sense, continuing professional development. So because it's a certification in most states, like what is the continuing education requirements for it, and what can we teach this workforce to enhance their skill set, to enhance their knowledge, and to advocate for a career ladder. So just because most often it's an entry level position, because the requirements associated with we're not asking you to have a bachelor's degree, but we're asking you to be in recovery. And getting a bachelor degree along that might increase your compensation, or it might increase your level of a hierarchy within an organization. And so I kind of help states and help different organizations kind of think through what that looks like, and how to best retain and keep peers in the workforce. And one of the biggest things right now for me in my consulting role, and as I think of the workforce itself, is how do we best support people in recovery when we're asking them to do something very a heavy lift, re-traumatizing in some capacities. Like, how do we make sure that peers stay well themselves? What's the focus and the emphasis on self-care practices? And the mental health field in and of itself needs to also embrace self-care, and for the most part they do, but a lot of times we have people in the field that want to fix and are caretakers for everybody, but you've got to put your own mask on first, just like the airplane people say, flight attendants, flight instruct us to do that, because you're not really worth a damn if you don't have the oxygen yourself, or you're not practicing the tools that you're trying to share. And so one of those huge pieces for me in the next few years is to really create an infrastructure to provide supervision and support for peer recovery support specialists. and again, I only learn from my mistakes and my successes, and this was a big fail on my part. Getting the cart before the horse, getting all of these people certified and credentialed and compensable with Medicaid and different insurances, but there was no infrastructure to support them on the ongoing needs of when they have a difficult client or a difficult, challenging situation. Then they need a supervisor to be able to kind of talk through that and ongoing development around that. We all need a good supervisor. That's why people leave their jobs. It's because they feel supported in their roles and they don't see a future for themselves. And that's no different from mental health roles and positions. And so for me and my consulting business is to really establish that infrastructure of supervision for peers. That's
awesome. That's great. Yeah, I love how much passion you have behind all of this. It's fantastic to see. I'll tell you a little bit about my history. I've been in technology for the last 30 years, working my way all the way up from Microsoft DOS and Windows 3.0 to where we are today. And over the course of this mental health journey, I've decided to make a big shift, and I put my head down and just learned everything I could about AI. And I'm taking my 30 years of IT experience and putting AI on top of that. And as part of the mental health journey, we talked about being of service and helping others, and that's sort of it's a cycle. You help others and it helps you. Yeah. And so I've sort of made it my mission. I started my own consulting company called Flow Vector Systems, and so that's what I'm doing is I'm taking my experience with corporate technology for the last 30 years and everything I've learned in AI, and just trying to help small businesses get started, because there's a billion tools out there. Nobody knows where to start. They think, oh, I guess I should get a Chat GPT account and start to figure some of this out. But they don't know exactly, how do I make this work in my business, right? And so that's what I'm trying to do. I'm trying to go help folks get started, and either set them off on their own journey, or set up services for them that I can help them run through a cycle, and not necessarily replace their people, but it offset the time that the people are spending on tasks that are right, sort of useless. AI can do that, right? You want your people working with your clients, your customers, the folks that need mental health services, that sort of thing. So you're not spending all your time doing data entry or processing things. So yeah, that's kind of my goal in my journey, and I feel like one way that I can give back to the community. Yeah, well, I think we're all in some form or fashion afraid of the fear of the unknown. It's like they're going to take our jobs. I remember when we automated the process to apply for peer certification, or being a case manager, or your license to be a therapist, and the people involved with that process, where they would manually take things and scan things and data entry. And when we found some technology tools that will help us, that was immediately the fear is like, oh no, I'm not going to have a job anymore. It's like, no, we're going to be able to use your brain more. Said automate these processes. Don't worry, we still need you. We just be able to better utilize your intellect and your talents. Yeah, absolutely. Yeah, that's definitely the message I'm trying to promote. Can AI take over someone's job? Well, if your job is just hitting the same button over and over again, yeah, it can. But if you're using your brain, if your personality matters, if you're doing something with a team, let's get those annoying tasks out of the way, so you can go and be a better participant, and focus more on growth for the company, growth for yourself. There's a million different things you can do, and so that's what I'm trying to do. I'm trying to help other folks with that. Awesome. We need it. Yeah. Very good. Are you using AI in your practice at all? Oh yeah, all the time. Okay. A lot of it is to help kind of source for me different documents or the latest research as a result of the integration of 988, or what peers are doing, or what we see different effective tools
and then helping kind of accumulate that for me and make it more digestible and synthesize it so that I can, share that information. And yeah, it definitely makes me a better consultant to be able to know, what the latest and greatest is without having to spend hours, trying to dig it up and find it myself.
Yeah, absolutely. It is such a great tool for taking large volumes of information and consolidating it into something that's digestible. Yeah, fantastic. I use it all the time for that. So, yeah. Great. Well, Heath, it's been a pleasure talking to you. Is there anything else you wanted to cover before we sign off for the day?
No, I'm just I'm excited for the opportunity, and I'm so glad that you reached out, and I'm ready to see what you do next. This is great.
Yeah, awesome. Very good. Well, I appreciate it, and yeah, I'll get back to you with some more information on this recording. At the same time, if you think of anything, or you have folks that maybe need some help with AI,
okay,
and getting started in their business, think of me. I'd love to help them out, and yeah, I'll be in touch soon.
Sounds good.
All right. Thanks, Heath. Have a great day.
Bye bye.
Bye.